Hello everyone. It's pleasure to have you all here as we continue to witness the rapid advancement of artificial intelligence. Its impact on healthcare has been profound and transformative. Today we will delve into a crucial aspect of this transformation, the utility of AI in effective patient engagement. So, our discussion will focus on how AI technologies, including chatbots and virtual assistants, are revolutionizing the way healthcare providers interact with patients, engaging communication, improving patient experiences, and ultimately leading to better health outcomes. What makes this session even more special is that we are joined today by Dr. Deepak Puri, who is a renowned figure in cardiac sciences, currently serving as a global chairman at Cardiomersion. With over 2 decades of experience, he has held key roles in prestigious institutions like Max Mohali and Fortis Mohali. Dr. Puri's expertise lies in minimally invasive cardiac surgery, advanced coronary interventions, and stem cell applications in heart failure. He has received numerous awards and has published extensively in international journals, cementing his reputation as a leader in the field. We welcome you, Dr. Deepak Puri, sir.
Thank you so much. A very good evening to everyone.
Good evening, sir. So now it's time to hit the short and exciting fireside chat. So our first question for you, sir, would be that how can AI empower healthcare professionals to deliver more personalized care while managing increasing workloads?
AI definitely helps us a lot in delivering uh, professional care to the patients in a personalized way because nowadays, like especially in our specialty, it's a round the clock kind of a job, and we have routine work and we have emergencies, and sometimes we cannot stick to the schedules. So
Yeah.
artificial intelligence helps us a lot because by making things simple, by scheduling our routine patient OPDs and follow-ups, and also by taking a chunk of our time which is utilized in filling the data documentation and all. So if the AI can take over that part, we will have more useful fruitful time to interact with the patient. And if we get ready-made data, and if we can get access to the previous reports and the trends, so we can get an idea about how the disease has been progressing, and we can easily then take decisions based on the data. Otherwise it will be a wasteful expenditure of so much time going through the previous records and going through the previous reports and then coming to the conclusions.
Right, sir. I completely agree, and thank you for your insightful response. Yes, to summarize what you have said, we can definitely say that AI can empower healthcare professionals by automating routine tasks, basically. So, uh, AI can analyze patient data to provide tailored treatment plans, also, and thus it facilitates real-time communication through virtual assistants. So, this also allows professionals to focus more on direct patient care and complex cases instead of focusing on the engaging with the patients, and thus it enhances personalization while efficiently managing their workloads. So, coming on to our next question. So, sir, how can AI enhance communication between patient and healthcare providers and foster better engagement and understanding?
So AI has been enhancing the engagement with the patient because when we get more time, we can spend the time in the clinical assessment, and we can assess the patient properly. Like AI can help. Sometimes the patient may be communicating in a different language, so AI can help us in understanding what the patient wants to say. And sometimes, like especially after COVID, like the distant communication, like telemedicine and like video talks and video consultations, they have become very popular now. And we can also distantly monitor the patient. Patient's information can reach us even from a distance, and we can counsel the patient, and we can deliver treatment to the patient from far off. So all these things have helped us, and also we can assess the risk stratification of the patient in planning therapy and in delivering therapy, even in educating patients. Like we can make them adopt healthy lifestyles, and we can also make them take home medication, and being less dependent on seeking medical consultation for small things. So all these can be properly done with the help of artificial intelligence.
Completely agree, sir. Thank you so much for your valuable insights. And yes, AI enhances communication by providing 24 by 7 access to information through chatbots. And as you mentioned, that it can understand different languages as is a concern of different people, that how we will communicate with the doctor. So it bridges the gap between a doctor and a patient also, and thus it personalized interaction based on patient history, as you mentioned, and enabling real time feedback to the patient. So all of this only fosters better engagement and understanding, and thus patients feel supported and informed throughout their healthcare journey. So thank you, sir, for your insights. And now moving towards our another segment, that is the storytelling session. So, sir, we would like to ask you that can you please specify any patient story where AI played a crucial role in transforming their care and engagement?
Definitely, every day we have so many stories, and
Mm,
like I'll tell you small example. Like we have a lot of patient with heart failure, and as the burden of heart failure is increasing day by day, we do a lot of surgeries on patients with ischemic heart failure who come to the hospital late with a heart attack, and by that time the muscle is already damaged. And many times even if we do the surgery and we do bypass or we do any procedure and we give them the best treatment, still their muscle, which is already irreversibly damaged, may not recover. But nowadays, like we have tools which help us in diagnosing the patient very quickly, and like automated, like in the echo machine, immediately we can come to know about the ejection fraction, and we can measure the dimensions, we can measure the volumes, we can measure the pulmonary artery pressure, we can measure the amount of mitral regurgitation. So all these things can be readily diagnosed. But sometimes we have complex cases, like once we had a child who was 10 years old, and he was presenting with the heart failure. And then on the routine investigation, like then we had a suspicion that there was a lesion in the chest x-ray, and then the CT scan was done. And ultimately we came to the conclusion the patient has a AV malformation, arteriovenous malformation. So that patient, then we took the patient for a pulmonary angiogram, because the we had to delineate the feeding vessels. So there were number of feeding vessels which were tortuous, and they were feeding from the upper surface, from behind and from below, from all around. And we had to plan the procedure. So then we had a discussion with the cardiologist also, and it was no way that it could be done with a percutaneous stenting or any other percutaneous procedure. So then we planned a surgical procedure. So what we did was that we planned a segmental resection of the part which was having the AVM. and that was lying between the upper and the middle lobe. So it was very near the artery which was supplying the lower lobe. So if we had to remove that segment, so we had to protect the pulmonary artery which was supplying the lower lobe, and at the same time we had to make sure that all the branches that were feeding the avm, they were taken out so that we don't have a recurrence. So we sat with the radiologist and with the 3D uh, reconstruction, we saw all the arteries and we measured the arteries and their distance from the pulmonary artery, which was very crucial to be. Uh, we had to save that artery so that if we don't save that artery, then the entire lower lobe will be gone. So then we reconstructed everything and we did our homework well, and we measured all the distances, and then we took the patient for a video assisted dissection of the affected segment. And then just with a video assisted surgery we could resect the segment without harming the artery which was supplying the lower lobe, and we could preserve the lower lobe as well as the upper lobe and the middle lobe also. Only that segment which was affected, that part was only removed. And after the surgery, the patient had a dramatic recovery. The child was totally blue when the child came to us, and later on, like the saturation also improved, and the child had a very rapid recovery. And now the child is coming for follow up even after 1 year. So he's growing fast and he's absolutely normal. So such
Okay.
kind of
Thank
things were
you. Yeah.
possible with the help
Mhm.
of artificial intelligence and support from the
Yeah.
3D reconstruction by the radiologist.
Completely agree, sir. Thank you for sharing that compelling story. And the patient story that you shared has definitely highlighted how can significantly improve care by providing personalized treatment and recommendation and continuous monitoring. That story highlights that how it can lead to enhanced patient engagement and better health outcomes. So the next thing that we would move further with is what is a future AI driven innovation in patient engagement that you are particularly excited about?
So in cardiology, there are a lot of future innovations that are now being developed, like uh, in Mayo Clinic and in US, a lot of studies are being done, mainly on the uh, things that are of concern to us, like heart failure, arrhythmias. So I'll give you an example that just by looking at the ECG, you cannot diagnose heart failure if you look at a routine ECG. But lot of ECGs were fed from patients who were having heart failure, and it was correlated with artificial intelligence. And from that, like they, it was found that even before you develop a frank heart failure, you can detect it on seeing a just a routine ECG by artificial intelligence. So the accuracy was as much as 93%. So which is like really encouraging. And also it was found that in those patients who came false positive, like some ECGs, they were reported as heart failure by the artificial intelligence. But actually, when the echo was done, it was found that it's not actually, there was no reduction in the ejection fraction. So then normally we label those patients as false positive. But actually, when these patients were followed up, it was found that later on, after some time, these patients, they developed heart failure. So this is very important because by just by artificial intelligence help, we can predict the uh, tendency of that person of going into heart failure in future. So if we are able to predict that, we can prevent the patient from going into heart failure. So this is having a very important predictive value. And also we could predict the presence of atrial fibrillation, like if you see a normal ECG, but still the patient may sometimes have stroke. So then doctor may be wondering that patient doesn't have atrial fibrillation, then what was the cause of embolism? So it was seen that if the patient was followed up, like it was found that the artificial intelligence could predict the development of stroke later on, or maybe the patient had stroke on previous few days but then reverted to normal rhythm. So just with the help of artificial intelligence, we can find out which patient has a tendency to go into uh, the atrial fibrillation, and then we can plan the treatment. And also we can predict whether some patients may be in a atrial fibrillation, but they may not be equally at risk for getting stroke. Some people get stroke, some don't get stroke. So artificial intelligence can help us identify which patients are likely to have stroke, so we can plan their treatment. And some patients who are given blood thinners and to prevent stroke, and later on they develop hemorrhage, and because of the hemorrhage then again they have stroke. So we have, especially in elderly patient, so we have to find out which patient to start treatment, which patient not to start treatment. So we need the help of artificial intelligence to find out all these things. And also now there's a lot of research going on in which we can do a multi-modality kind of assessment, like a patient's ECG, patient's echocardiography, MRI. They can, along with the clinical history and examination of the patient, can be pooled together to make a final diagnosis, which will be more accurate than by seeking the individual investigations. And we can have a more clear picture about the pathology, and we can even determine the problem at a much earlier stage, because we can assess the molecular changes and the other changes that are occurring before actually the complication occurs. So all these things can help us in pre-diagnosing the disease and properly treating it before any complications.
Yeah.
And
So
also
thank you for sharing. Yeah.
we
Sorry.
also assume that robotic surgery is
Yeah.
now the talk of the town, and everybody wants to get a robotic surgery done. But I think the actual application of robotic surgery will be when artificial intelligence is incorporated into the robotic surgery, so that it can help us in doing things that presently we are not able to do. So there's a lot of research going on all this, and I hope that in the near future, like even like the smart watches that we have, so if in the smart watch we can incorporate the program by which we can detect whether the patient is going to have a heart attack in future, so we can prevent that. And lot of research is going on all these things, that we can diagnose the disease before it occurs, so that we are able to prevent it.
Yeah, so thank you for mentioning about robotic surgery here. It would be a different, altogether a different discussion in future, a different live session on robotic surgery.
Yeah.
So, yeah, thank you for sharing your perspective on this exciting development. And yes, we can definitely say that the future AI-driven innovation in patient engagement that stand out is the use of predictive analytics. So this is the term we can give, that is predictive analytics, to anticipate patient needs and provide proactive care. And as you mentioned that the AI helped doctors to predict about the heart failures and strokes. So yes, the predictive analytics innovation has the potential to significantly enhance patient experiences by addressing health issues before they escalate, and thus it can lead to more personalized and preventive healthcare. So now it's time to debunk some myths and uncover truths in our myth busting round. So there is a myth that AI is only accessible to large high tech hospitals. So, what are your views on this, and how can smaller clinics and practices benefit from AI?
No, it's actually not true because AI is not only restricted to larger hospitals. AI, rather, I would say it is more useful for smaller hospitals because once we get the collect the data, we can always easily make it accessible to the bigger hospital, and we can also screen the patients who need to be referred to a higher center, and instead of sending every each and every patient to the higher center and increasing the workload of the higher center,
Yeah.
we can actually screen them at a lower center, and then once the patients who can be treated there can be treated at the lower center also, and those patients who actually require the services of the higher center, they can be referred to the higher center, so that will decrease the workload of the higher centers also, and it will improve the efficiency also.
Also, I would like to add it would decrease the cost also. It would save the cost of the small clinics.
Definitely, I thought you will ask me about the cost separately.
Yeah, this would be another question, sir. That there's also a perspective that AI driven healthcare is expensive and increase cost for patients. So, how can AI help reduce healthcare cost for patients?
Definitely, AI will help the reducing the cost for the patient, because it is a myth that AI is going to be costly, because the only
Yes.
cost that is involved is in the initial stages in developing the AI programs, and once the program is ready, then it is accessible to the everyone, and then it will rather reduce the cost, because we can easily screen patients and then identify which patient requires what services, which patient require what investigations. So instead of doing wasteful investigations, we can simply screen patients who are at high risk and more likely to need the investigation. Then we refer those to the higher center for those investigation also. Like we in the medical science, we do a lot of multicentric trials to find out the efficacy of any medicine, and also like nowadays we think about screening the patient and identifying whether this patient is going to respond to this treatment or not. So all these things can be done more easily by artificial intelligence, because then you don't need to go from one place to the other, and don't need to conduct so elaborate trials. Like I'll give you a simple example that uh, you see the calcification of coronary arteries in a simple CT scan, and from that you can find out that this patient is likely to get a heart attack. So whether this patient requires a coronary angiogram or not. So you need not do multiple center trials. You can access the database of the center, and from like the CTs that have been performed, they may be performed for any other problem, like a CT performed to screen for the uh, uh, like cancer of chest. So that CT can be screened, and then from there we can find out which patient they have calcification. So we have easy access to we can screen say thousands of CTs, and from that we can find out which patient has got the risk for coronary artery disease. So there's no extra expenditure. It's already the test has been done. Maybe it has been done for some different reason, and when we screen from that, we can find out which patient requires treatment for coronary disease, so we can refer to that clinician who is treating that patient. Maybe patient had chest x-ray for screening for lung cancer, and we give additional information that this patient has developed calcification. and he may be having an underlying cardiac problem. Otherwise,
Hmm.
the patient may die because of cardiac event rather than dying because of cancer. So
Yes.
it can simplify the screening, and it can simplify the delivery of care and simplify the treatments also.
Thank you, sir, for sharing this story and the facts through which we were able to address this important concern. And I would also like to add that AI can reduce healthcare costs for patients by improving operational efficiency, and thus they enable early detection and prevention of diseases, and reduce the need for unnecessary tests and procedures also. And this efficiencies led to lower overall healthcare expenses and more affordable care for patients. So that's it for the day, sir. Thank you, sir, for an incredibly insightful and engaging live session. Your
Thank you.
expertise and examples have truly illuminated how AI can revolutionize patient care and engagement.
Thank
So
you.
we
And in
appreciate
the
your
end, I
time
would
and
like to
look forward to seeing these innovations.
thank you. In the end, I would like to add that all the healthcare professionals, we should take artificial intelligence as a tool, and we should not consider it as a threat,
Yes,
because it will help us in
yes.
becoming better clinicians and in delivering better care to the patients.
Yeah, thank you so much, sir, for engaging our audience into such insightful session. And to all our attendees, let's keep the conversation alive beyond today's session. Get ready for more dynamic live discussion coming your way soon. Thank you.
Thank you.